Well, a very good morning. My name is Jagan Asemakwa once again on this day. It is the 5th of May in this year 2020. Now, today is a special day, and we are first and foremost sorry for having started at this time because not as we normally do it. My guests today are actually more than those that you've always seen on Good Morning Uganda Extra, because today is the International Day of the Midwives. Now, with me in studios is the Honorable Minister of State Minister for Primary Health, Honorable Joyce Muriku Kaduchu. With us here in studios, you're very welcome, Honorable Muriku Kaduchu.
Thank you.
Thank you so much. Honorable Muriku Kaduchu will read to us a statement, and just next to me here is Mama Agnes Chandia, the Assistant Commissioner for Nursing from the Ministry of Health. You're most welcome, Sister Chandia. Okay, and of course, next to Chandia here is my sister Maria Najemba, the program analyst of Midwifery from the UNFPA. You're also very welcome.
Good morning, viewers.
Thank you so much. And of course, the president of the National Midwives Association, just right there, Kanyunyuzi Annette Evelyn. You are also welcome.
Thank you.
Now, welcome you, Minister Kaduchu, to actually read us a statement over this particular day.
Thank you. Good morning, fellow Ugandans. Today, let's join hands together as we honor the International Day of the Midwives. The Ministry of Health, in collaboration with United Nations Population Fund and other stakeholders, today, the 5th of May 2020, we commemorate the International Day of the Midwife under the theme Midwives with Women. Celebrate, demonstrate, mobilize, unite. Our time is now. The year 2020 was also dedicated and declared by World Health Organization as the International Year of the Nurses and Midwives, and therefore this calls for celebration, which is even higher. The theme for this year's celebration and the highlights on how midwives and women can partner together to mobilize and unite towards a shared goal of gender equality. Midwives all over the world work with women every day as they partner with them in their care, and they have a unique opportunity to get to know each other, and they build trusting, they replicate relationship through continuum of pregnancy, care during labor, child care, and thereafter postnatal care. Midwives in Uganda, they use their voices to speak up in the community. They get involved in community discussions around female gender mutilation. They get involved in child marriage issues. They get involved in contraceptive issues and sexual reproductive health and rights of women and girls. They can do and they do play an active role in driving progress towards gender equality in our communities. Midwives, most especially in Uganda, they play a very crucial role in responding to public health emergencies, and most especially at this particular point in time, the current COVID-19 pandemic, which has already affected and infected more than 1 million people world over, including Uganda. Midwives and other healthcare workers are unsung heroes working on the front lines. Midwives have remained brave and they are courageous. They save lives of pregnant mothers and newborn babies. The midwives ensure safe and healthy pregnancy for our mothers, taking every single precaution to protect the women and to save their life. Each year, fellow Ugandans, thousands of mothers, thousands and thousands of women, they die, and almost 3 million newborn do not survive in the first week of their life because they lack access to maternal health care services. They also lack access to skilled midwifery services. For every maternal death, another 20 women face serious or long-lasting illness or disability like obstetric fistula. Evidence shows that midwives who have dedicated and regulated to international standards, they can provide 87% of the essential care that is needed by women and their unborn babies. As bridge between communities and traditional healthcare facilities, midwives deliver vital maternal healthcare services that are key in reducing maternal deaths and making childbirth safer in remote and underserved areas and in humanitarian crises. Midwives not only save lives, they also empower women and couples to make informed, healthy choices in life. The Ministry of Health is working very closely with different partners, development partners like UNFPA, to attain the required competent and skilled our midwives deserve and the skills that the midwives in Uganda needs. In collaboration with the Ministry of Education and Sports and with support from the Swedish government, midwives for hard-to-reach areas like Karamoja are trained on scholarship under a bonding scheme. This has so far helped in bridging the staffing gap, and it has yielded lots of results. For example, skilled attendance rose from 58% in 2012 to 74% in 2016. This is according to Uganda Demographic Health Surveillance of 2016. And maternal mortality has also really significantly reduced from way far 438 to 336 per 100,000 live births. It is therefore worthy celebrating our heroes and these life-saving workers. We are celebrating today the heroes, and we are celebrating the life-saving work that the midwives in this country are doing. Oftentimes, they are trying their best under every circumstances, noting that in Uganda, 7 out of 10 births are now conducted by skilled providers, usually and in most cases the midwife. However, we still have gaps, and there is still a need to continue investing in interventions that bring high impact outcome, like ensuring that midwives are evidence-based. Ladies and gentlemen, currently in Uganda, we have a total of 20,475 midwives. These are registered with the Uganda Nurses and Midwives Council. Out of this total, 22 have bachelors in midwifery. 22 of them have got bachelors in midwifery. 6,425, they are diploma holders, while 13,947 midwives are certificate holders, and 80 of these are midwifery tutors. One FPA, the Uganda Nurses and Midwives Council has developed a geographic information system to track and monitor nurses and midwives for their availability. They track their location, distribution, and deployment. The system also informs on validity of practicing licenses, which contributes to safe practice rendered to the community, and it will go a long way in informing the need for training midwives and nurses in this country, most especially the need for training more midwives. As we celebrate International Day of Midwives today, the Ministry of Health acknowledges and we recognize and support all our dear midwives all over the country. Wherever you are at this point in time, we acknowledge and recognize your contribution. We congratulate you and we wish you a very happy celebration. And the ministry is committed to increasing investment in improving the working relationship, the working environment for our midwives to ensure a committed and motivated midwifery workforce to better service for our country and for our people of Uganda. On such a day, we are also reminded of the achievements of our midwives. Humanity is because of you, the midwife. We therefore celebrate the success of our midwives today, and we focus on recognizing the importance of midwifery. It is also a day really to reiterate and call attention to the improvements still in healthcare service delivery. We are calling upon our people in Uganda to ensure that all women have access to a qualified midwife. I wish to use this opportunity to thank the midwives and other health workers in this country for a job well done. They are doing their best to save lives of women by providing good services, especially in such challenging situation as we fight the silent war of COVID-19. I also wish to thank all our development partners and stakeholders for the support so far you've rendered to the Ministry of Health towards improving the service delivery among our midwifery. I call upon all policymakers, I call upon all stakeholders, government and the entire population of Uganda. Let's join hands together. Today, as we celebrate the International Midwifery Day, we are not in position to go out as usual to celebrate in a manner that we used to do. We all know the reason. It's because we are in a war mood. We are in the fight against COVID-19, and that does not permit us to go out and celebrate this day vividly. However, in our own style, in our own way, wherever you are, remember that today is International Day of Midwives. So get to the modes of celebrating the success, the achievement of our dear midwife. Let's show our utmost appreciation for the tireless work midwives have done to safeguard the health and the well-being of women and babies in this country. Once again, congratulations to all midwives wherever you are. Know that we value you, we love you, and we appreciate your service for God and my country.
Thank you so much, Honorable Kaduchu, State Minister for Primary Health. We thank you so much for that statement. And I will just request now that Actually, I wanted to take you on a little, but because you've just read the statement, I think I will just get to the president of the association, the Midwives Association. We know that midwives constitute about 80% of the health workers and the health workforce globally. And we know that you are the cornerstone of any health system. And world all over, health systems wouldn't work without you and possibly without your support. Talk to us about what your role has actually been in this time of the COVID pandemic, what you've actually done, where you are, and how pivotal you've been in the fight against COVID-19.
Thank you very much, moderator. Indeed, you've rightly said that... I'm going to stand, yeah. Thank you very much, the moderator, for this opportunity. And indeed, midwives are the backbone of every healthcare system. They are the frontliners at every battlefront. And indeed, our midwives have not deserted the workstations. Despite the challenges that we are experiencing because of COVID, you'll find a midwife at a workstation, ready to receive the mothers. In relation to COVID, we've decided to change the approaches that we care for these mothers, because we appreciate that mothers are unable to reach to us timely. So we are modifying birth planning to ensure that the mothers redesign their birth plans and are able to come and seek the services timely, because when it comes to pregnancy, timely attention and seeking of services is critical. We also are intensifying sensitization and awareness creation, because we appreciate that without knowledge, without this, mothers being empowered to decision making, then we are going to lose time. So that is one of the areas we've intensified to ensure that mothers are empowered and are able to make right decisions. Yeah.
Statement, she just read to us the statistics here, and she painted a picture of how many are these and she said 20,000, and those are the figures just right there, those with BAs, with diplomas and all those. How many of these are employed by government? Because it's one thing for somebody to actually have, how many of these are actually employed with government and with the private sectors, especially with the non-for-profit organizations?
Of course, there are variations. We have the largest percentage. Under public service, but we have our counterparts who are also in private practice as well, just as the summary was done by the minister.
My worry is we may have many who are actually again now on NASA vetting different businesses, because it's one thing for somebody to have a diploma in nursing or midwifery, and you actually find them doing different businesses, because I think that's what I want to know. I will request also my sister Najemba here from UNFPA to tell us, in 2018 there was a pledge by UNFPA to actually support the midwifery services. I just want to know from you how UNFPA has actually supported midwifery and the midwifery services in Uganda. Just leave that and
thank you very much for...
Stand in the middle of the flags. Just stand in the middle of the flags.
Okay, thank you very much for the question. As you are aware, like you have rightly said it, UNFPA has played an instrumental role in supporting the midwifery program in Uganda.
You will stay.
Right from supporting the training of midwives and a bonding scheme, supporting them to associate in order to make an association, and supporting them with equipment, supporting them with the knowledge. And from 2018, like we have said, with the support from the SIDA government, the midwifery program in Uganda has been established. Right now, as we speak under COVID, you remember the president of the Midwives Association has just told you that they had issues of mothers accessing services, mothers, even midwives accessing services. UNFPA, working in collaboration with different districts, has...
It's okay. We can hear you.
This one is...
Just leave that. We can hear you.
UNFPA, with the support from other development partners and working with the districts and Ministry of Health, has supported districts in West Nile, Northern, and also Karamoja region to ensure that they have fuel to transport mothers to the health facilities, but also facilitate midwives to be able to reach the health facilities so that they can offer the services. So on such a day, we have to celebrate with these midwives whom we are supporting. We have supported them in so many other ways, but right now we are also doing the support to ensure that the services are accessible to our mothers, but also the midwives.
Okay. Well, just before you get off the stage, pregnancies, childbirth, and all these things do not wait for pandemics, and pandemics do not wait for them. So we can't say because there is COVID here. So we request people that did not get pregnant. I will not tell people that they shouldn't actually go and give birth. I want to see how you actually coming in to help them, the midwifery especially, at this time especially, where we are in this pandemic, and there's things that do not wait. Now, this is just like all the other health hazards, but we're now talking about pregnant mothers and giving birth. None of these will wait for the other. I want to see where UNFPA is in helping this.
In helping to do what?
In helping to manage the situation, especially of the women now. The risk that they're going through, and because they are frontliners. We see them at the front line. We need them. They are there. Like I said, we will not wait to get pregnant because there is a pandemic. We will not wait, we will not postpone giving birth because there is a pandemic. I want to see the role of these international agents in helping out midwives who are at the risk.
Okay, like I've already said, you have supported them to reach the facilities, but we are also working hand in hand with the Ministry of Health to ensure that the services, the SRH services, continue despite the pandemic.
Okay.
So in terms of providing PPEs, we have gone ahead to provide the PPEs to some of the districts in the northern and the West Nile districts. But we have also supported the Ministry of Health to come up with the guidelines of how these services can continue despite the pandemic.
Okay.
So UNFPA has been also at the front line of ensuring that services, despite the pandemic, the SRH services continue, the family planning continue. We are working with the safe borders in the Kampala region to ensure that condoms reach the vulnerables.
Okay.
So services, we are continuing despite this.
Thank you, Sister Najemba. Now to Chandia. Chandia here, the Assistant Commissioner from the Ministry of Health, Assistant Commissioner for Nursing. You will address us on how government has actually aided and helped in helping the nurses, because that's where you are. We just need to know and how much government is investing in nurses, because if you constitute 70 to 80% of our workforce in the health facilities, then I think you are the engine there, and we can't do away without you. Yes, Madam Commissioner.
Thank you, viewers. And thank you for joining us to celebrate this great day of the midwives. Sorry.
It's okay.
Once again, thank you, viewers.
I request that you stand in the middle of the flags.
And
very good.
Thank you, everybody who has been able to associate and also cherish the milestones which has been achieved by midwives, and we would like to thank our government for putting it within this hard time to come up and associate and also stand firmly with the midwives to celebrate this International Midwives Day. And I'm really happy, and I would like to convey to you that our government has commitment towards not only nurses, but also nurses and midwives and health workers of this country. And in that regard, we are able, through other global initiatives, to take up the contribution of nurses, optimizing the contribution of midwives in a manner of having a whole division for midwifery within the ministry, which are able to come up with the policies and also strategies of how to improve the welfare and also work stations and work aspects of what midwives could be able to do and deliver at a given time, and also to protect them. So in that regard, we also have arm of regulations which are there to monitor through the support of, for instance, of UNFPA, where we have introduced JSA. We are able to know where our midwives are and how are they operating. We are able to bring the challenges of midwives on the table within the Department of Nursing and be able to discuss it at policy level with our senior top management. And I'm happy this has been effectively demonstrated by our health minister of primary health care being here in this studio to appeal to everybody to cherish and stand with the midwives, especially for today.
Okay, we are wrestling against time, but just address us on the stillbirth, the neonatals, and the maternal-related deaths that could be happening, because all our focuses are now on COVID-19, and we're forgetting how many mothers are dying. We are forgetting of those who are giving stillbirth and the neonatal. Could you just please paint a picture to us and know where we are standing as a country?
Yes, viewers, I don't want to cause alarm, and we don't want all of us to get scared that the maternal, neonatal, and prenatal death is increasing. As Minister of Health, we have already developed a COVID-19 guideline which has various protocols in various programming, including maternal child health, such that we are able to reach the mothers, we are able to reach the community, to be able to offer services which are appropriate and for the mothers and the babies to save their lives. So we are not sleeping, and that is one of the areas where we have developed protocols and which is guiding the various health sectors and also practitioners to be able to have a positive contribution towards the mothers and babies during this COVID response.
Okay, well, I thank you so much, Assistant Commissioner, just right there. Honorable Minister, I'll take you back to the stand there, and you addressed me on one issue, which is, of course, yours personal, but also one from me here. We know very well that in February this year, Uganda was set to host a high-level meeting of medics to discuss a number of issues for the nurses in Uganda and, of course, Africa at large. Did that meeting happen because we had it locked down? And if it happened, what were the deliberations? And what did we as a country achieve from that high-power meeting?
Thank you so much. And I want to once again to congratulate the midwives who are celebrating the day of today as we take milestones of how much has been achieved, as we look at the challenges facing the sector, especially the work of the midwives. We, as government, once again appreciate all the work that the midwives have done. I want once again to remind people of Uganda to support our midwives. These are the skilled, competent health workers, the workforce that we have in the country. And they are the ones really to save the mother and the lives of our baby. So I call upon the people of Uganda as we celebrate this day, wherever you get a midwife, just tell her, thank you. We love your work. Keep up the spirit. Keep saving our mothers. That is my call to the people of Uganda. As we celebrate this day, there are a few challenges I want to mention to our people. We know that the day comes as we are fighting COVID-19. All attention is focused on COVID-19. But we still have the healthcare service to be given to the people, most especially the mothers. We've realized that the midwives have done a lot, and they are still doing a lot in helping the mothers to deliver safe, to deliver live babies. But the aspect of antenatal care is still missing. In very many hospitals, take a case in point of Kawempe Hospital, which is like our big mother headquarters, we still have gaps. Antenatal services are not being offered to all the mothers. Yet there are some mothers who are at high risk. There are mothers who really need attention. So I call upon all midwives and area managers in those areas. Let's strategically plan and see to it that how we can open a window for antenatal care. In some hospitals, antenatal care services are being offered. So let's give that window for high-risk mothers. We do not want to get a situation of obstructed labor, mothers who come in when they have already dead babies, mothers who will end up with the fistulas, mothers who will end up with a lot of complications due to pregnant-related. So let's avoid that by trying to scale strategically antenatal care service delivery. We still have problem in family planning. Mothers are not able to access these services, and yet this is the time where families are together. There's issues to do with domestic violence and many other challenges women go through. So this is the day we want to call upon our people of Uganda. We want to call upon midwives. Let's try to see what we can do for this single mother, to save her, to save the family from all the violence that she may be going through. We still have challenges, and we are going to get more challenges with teenage pregnancy. People are living together. There are some people who have no manners, no discipline. They go and move around with these young girls. So this is a day that we need to remind the people that please let girls be girls. We do not want a situation where we have achieved a lot and we go back to where we were previously with high pregnancy among the young people. And that is basically the message I want to pass to our people. But early this year, we are supposed to host a very high regional health summit that is supposed to be hosted by Makerere University with the Ministry of Health. But because of COVID-19, we are not in position to get this in February, even April. There were too many summits which are really big, and midwives and nurses are supposed to play a very crucial role, but because of this situation, it has been called off. Nevertheless, in your own way, I believe using the social media, using telecommunication, we can still be on board to get to learn through one another and to educate yourself. Don't sit down only for work, but make sure build your capacity and read more within this specific time. Once again, congratulations as we celebrate your achievement. Thank you.
Thank you so much, Honorable Minister. I want to thank you so much. I want to thank my sister Kanyinyuzi there, the President.
There was a question that was asked, how many midwives the government of Uganda has got?
Exactly, because you're the minister there, yes.
Because I've mentioned that in a total we have 20,475 registered midwives with Uganda Nurses and Midwifery Council. Out of the 20,000, specifically 12,313 are with the government of Uganda. So that means the bulk of the midwives who are registered are employed by the government of Uganda.
Okay.
The 7,000, probably, the 6,000 are in private sector.
Okay.
I thank you.
Thank you so much, Honorable. That's also very good. I thank you so much, Honorable Moriku Kaduchu. I thank Kanyinyuzi, the President of the Association. I thank Najemba here from my UNFPA. And I also thank Chandia, the Assistant Commissioner Nursing, who have actually joined me today. And I also want to join my voice at all the voices of these very powerful women here to also wish you a very good Midwives Day, or the Day of the Midwives. It comes this year, 2020, amid this pandemic. But nonetheless, let's see how to celebrate it scientifically, because we are now learning to live in the new normal. My name is Jagenda Semakola Ziksok. I want to thank you now and let you know that we'll go to our science class, and that day is for primary 5 before the others come on. And of course, later we'll also have Parliament with a special sitting. Bye for now. Good morning and bless you.